Hello, everybody. My name is Skylar Distelzwag, and I'm a student here at Wayne State in the Coordinated Program for Dietetics. I'm in my last year studying to be a registered dietitian, and today I'm going to talk to you about how to prevent and treat type 2 diabetes with nutrition. So, first off, we're just going to talk a little bit about what we're going to cover in this presentation. First off, we're going to talk a little bit about what diabetes is. We're going to break down some statistics on diabetes, talk about the types and complications and symptoms of diabetes. And we're going to move into diabetes management, talking about how you can manage yourself if you have been diagnosed with diabetes in terms of nutrition, and if you're at risk for diabetes, how to prevent it or at least delay its onset. And then lastly, we're going to touch a little bit on some emerging research. So, what is diabetes? So, diabetes, both types, and in all cases, it's caused by impaired carbohydrate metabolism. Either you have insulin resistance, which means that your cells do not really work with insulin properly, or you don't produce enough insulin, which also causes issues. Either way, the result of this is elevated blood glucose, which your doctor may refer to as hyperglycemia. It's just high blood sugar. And the result of that is these symptoms: excessive urination, excessive thirst, unexplained weight loss, dehydration, and electrolyte disturbances, even if you are hydrating properly. In some cases, you can even get ketoacidosis, and of course, hyperglycemia, as we already talked about. So briefly going over some statistics of diabetes in the U.S. So overall, 10.5% of the U.S. population currently is estimated to have diabetes. This includes undiagnosed and diagnosed people, so it's not an exact number, but it's a CDC estimate. So there's actually an estimated 21.4% of people with diabetes who may be undiagnosed. And 88 million people 18 years or older have prediabetes, which we'll talk about a little later. But it basically means they're at very high risk to get diabetes and most likely will if they don't change their lifestyle. Just to talk a little bit about Michigan, 1 in 10 people in Michigan, 1 in 10 adults, I should say, 18 years or over, have diabetes. So you can see that's about the average for the U.S., it's close to the 10%. And that's actually down a little bit from what it used to be. When I was younger, I remember Michigan was actually one of the most overweight states, and we were very high in terms of diabetes, and now we're kind of middle of the road, which is good. So this is just a map. If you are interested, this presentation is available for download here on the website. If you want to check out the areas that have a higher prevalence of diabetes, you can do that. This is also available on the CDC website. Now we are going to talk about the types of diabetes briefly. So what I want to do here is just briefly go over them. The focus of this presentation is type 2 diabetes, as it is far more common. And unfortunately, type 1 diabetes is not preventable, or at least we don't know of a way to prevent it currently. So type 1 is really an autoimmune disease. It's caused when antibodies attack your pancreas, and since the cells get damaged, you're no longer able to produce insulin. It's usually diagnosed early in life, but it can be diagnosed as late as 30, and it always requires anybody who has it to take exogenous insulin, which just means take insulin in any form because your body can no longer produce it. And as I said, it's roughly 10% of new cases, so most of the cases we see are type 2. Type 2, in contrast, usually the onset is a lot later, and it was even previously called adult onset diabetes. It can go undiagnosed for a long time without being life-threatening, whereas type 1, you'll most likely get severe symptoms right away. Type 2 is also highly associated with obesity, so you're at much higher risk if you are overweight. And It's characterized by insulin receptor defects. So your body still produces insulin in most cases, but because of those defects, your body isn't able to utilize it. And as I said before, there's a genetic component, but the main reason for its onset is environmental factors. So usually, poor diet and lifestyle eventually will lead to type 2 diabetes. Okay, so we're going to talk briefly about the complications in the short term. This is what we really want to avoid and what we're trying to treat when we are managing diabetes. If diabetes is unmanaged, you can go into a diabetic coma. That's extreme cases. Um, Diabetic ketoacidosis is basically when your blood pH drops so low that your blood becomes acidic, basically, and eventually your blood sugar goes so high it causes disturbances in the blood-brain barrier as well, and it can cause a coma. Hyperosmolar hyperglycemic syndrome is a similar thing, but it's more common in type 2, and ketoacidosis is more common in type 1. And then hypoglycemia can also occur. It's not going to happen in type 2 so much, but in type 1, it's the most frequent complication. And that is caused by mismanagement of the disease. So I'll go back to that maybe later in the presentation. Usually a result of not eating enough or timing your medication or insulin wrong in terms of when you're having it around food. So the long-term complications, if diabetes is not properly treated, there's macrovascular complications, which basically means complications of the large vessels. So cardiovascular disease, basically high blood sugar causes damage to your cells and vessels, and it puts you at higher risk for cardiovascular disease because of high blood pressure and irregular lipids, which is blood fat. And cardiovascular disease is actually the leading cause of death for people with diabetes. You can also get microvascular complications, which is complications involving damage to the capillaries. So retinopathy is diabetic blindness, essentially. You may have heard of people going blind from diabetes. That's what retinopathy is. You get damage to your capillaries and they leak fluid, which causes problems in your retina, and it can cause you to go blind, unfortunately. And it can occur into up to 80% of patients, usually 15 to 20 years after they're diagnosed. But it can be avoided to a high degree if you manage the disease correctly. And then nephropathy is just damage to your kidneys that can occur as well. Neuropathy is going to be in two groups. Peripheral is the limbs and the extremities, and autonomic is more central. So peripheral is just like you may lose feeling in your limbs and extremities, as I was saying, and that can actually lead to some problems with infections. That's why a lot of people have to get amputations, because they can't feel their feet maybe, and they get some injury there, or they get an ulcer, and then it gets super infected and they don't notice it until too late. And autonomic is erectile dysfunction. It can be gastroparesis, which is delayed gastric emptying, or it can lead to cardiac arrhythmias, which is irregular heartbeat. Okay. Okay, so now we're going to talk a little bit about diabetes prevention. Preventing type 2 diabetes is very important, especially for those who are at high risk. As we discussed when we were talking about the statistics, prediabetes, also known as increased risk for diabetes or IRD, affects approximately 37% of US adults and 23% of adolescents. If you think about that, that's almost half the population. So it's extremely significant, and this information can help quite a few people make better decisions every day and potentially reduce your risk substantially. So Briefly, I just wanted to show the diagnostics for prediabetes because if you go get tested for diabetes and you're not above these numbers listed here, then you still may be pre-diabetic, and that puts you at extremely high risk. But just because you're pre-diabetic doesn't mean your healthcare provider is necessarily going to give you a lot of information and make it seem like you really should be changing something, because they see this every day, and to them they're more worried about treating the people who already have diabetes in a lot of cases. So you really want to take matters into your own hands if possible. So that's why I included these numbers, because if you do go get tested, you can see the results, and if you fit these criteria, then you'll know you're at high risk for diabetes, regardless of what your doctor may tell you. Um, so the pillars of diabetes prevention, especially for those who are at increased risk, you need to manage your weight, dietary modification, make sure you're getting physical activity, and monitoring. So you should be getting tested yearly if possible. First, we're going to talk about weight management. If you are pre-diabetic, then weight loss of 2 to 8 kilograms or 7% of total weight can improve your risk substantially. Um, so I know it's a lot easier said than done. And a lot of people who are trying to lose weight have trouble doing it sustainably. So if you are trying to lose weight, the first thing you should think about is how you can do it sustainably, especially if you're doing it on your own and you don't have somebody guiding you. Or even if you do, you want to think about what they're telling you. If you have somebody who's telling you they can help you lose 20 pounds in 3 months, well, that sounds great, but it's probably not going to be sustainable. I'm sure all of you have heard of The Biggest Loser, the famous TV show, and there were some statistics published at one point, and a lot of them ended up regaining the weight. And it's not a pretty thing. It's an emotional roller coaster if you're losing and regaining weight, and that actually has been shown through research to be very harmful. So that's when I'm talking about the risks of weight cycling here in the presentation. Weight cycling is a term to describe extreme swings in weight over relatively short periods of time, and it's often a result of extreme dieting and caloric restriction. So researchers have defined this as losing and regaining 20 pounds 3 or more times. So that means you lose 20 pounds and then you gain it back, and you do that 3 times. And research has shown that individuals who experience these large fluctuations are actually at higher risk for obesity, hypertension, and all-cause mortality. So it can be a very harmful thing to go on these crash diets or lose weight extremely quickly. In terms of monitoring your weight, it really should begin in adolescence ideally, but unfortunately, in a lot of cases, it isn't talked about enough. So if you do have children and you have a family history of diabetes and they're at an unhealthy weight, it's best to consult a professional as soon as possible. It can be a difficult thing. It's really just best to talk to a professional, because they're going to know exactly what to do and they're going to know how to handle the situation. You don't want to be restricting your kids if you don't have to, so you definitely want to check in with a professional. But all at-risk patients ideally should be able to see a dietitian, because they're most likely going to be the most qualified to help you lose weight sustainably. That being said, I know not everybody can do that, and not everybody even has insurance nowadays because it is so expensive. So we're going to talk a little bit about how to lose weight on your own sustainably. So losing weight on your own, if you want to commit to this, then you want to do it the right way. And that is going to be to try and lose a half pound to 1 pound per week, as we already said. And how you're going to do that, the simplest way, in my opinion, is to use an energy calculator. I've linked one here and you just enter your height and weight, and it tells you roughly how many calories you're going to burn a day. It also asks you what your activity level is, so it factors that in as well, how many calories you're going to be burning. And once you know that, you can use an app to track your calories. It's not going to be exact, but as long as you're trying, then you will start to see results. So what you're going to do is once you know your total calories, you're going to eat at a 250 to 500 calorie deficit, which means you're going to eat 250 to 500 calories less than however much you're burning in a day. And that is going to be the most sustainable way for you to lose weight. So moving on to dietary modification, that's the second pillar of diabetes prevention. If you don't want to track your calories, which I know is a lot of people because it is a big commitment, there are a lot of other things you can do as well. You can just make some general healthy changes to your diet, which is what everybody really should do, and everybody can work on it, myself included. So some of the most basic things you can do are add some of these foods here. So you can increase your intake of whole grains, nuts, seeds, and fruits and vegetables. Whole grains are very important, and most people don't realize the significance of whole grains. They're very high in fiber, and they're extremely underconsumed in the United States. Fiber is one of the most underconsumed nutrients, and that's not good because if you're eating a lot of white bread and just high glycemic index carbohydrates, which means carbohydrates that don't have a lot of fiber, it's going to cause you to gain weight if you're eating them in excess. So you're going to want to try to switch to whole grains as much as possible. An easy way to do that is to swap out one meal to begin with, like breakfast. You can just have oatmeal, and oatmeal specifically actually is proven to lower LDL cholesterol and can reduce your risk of cardiovascular disease. So that's an easy change you can make. Another thing you can do to increase your intake of fruits and vegetables is make smoothies in the morning or throughout the day. And you could get everything in there if you wanted to. You could get your nuts and seeds and your fruits and vegetables for the day in one smoothie. Another big thing that everybody already knows about is limit added sugar. Right now, it is a big problem. I know it gets talked about a lot, but it's important to mention because it's so common for people to be drinking sweetened beverages throughout the entire day. I mean, I know I have, a coffee from Starbucks every once in a while in the morning. That's probably not the best. Frappuccinos and things with whipped cream and a bunch of calories and sugar. It adds to your total intake, which can, of course, cause you to gain weight, and it's not the best thing for you. The other thing is you should try to limit your fat intake to a degree. You don't want to avoid it altogether. I'm not saying to go on an extreme diet at all. Just saying don't eat it in excess. And the easiest way to do that is to just avoid fast food and fried foods as much as you can. It's okay to have French fries every once in a while, but if you're having burgers and French fries every night, for example, then it's going to become a real problem. And fat has actually been linked to insulin resistance as well. So in addition to causing you to gain weight if you eat a lot because of the calories, it also could be problematic specifically for diabetes. And the last thing you can do is eat at consistent times and try to avoid snacking throughout the day. This is just going to help you reduce your overall intake for the most part, because if you are eating at consistent times and being mindful and focused while you're eating, you're listening to your body and you know when you're full and you know when you're eating, and you're just able to realize when you're full. That's the main thing, and so it prevents overeating to a high degree. And of course, you don't want to be snacking throughout the day. It's okay to have one here and there, but it's better to have consistent meal times and maybe one or two snacks at consistent times throughout the day. Okay, so the third thing is active lifestyle. This is a big one, of course, too. Most people don't get probably this 150 minutes of moderate physical activity per week. In fact, I know most people don't. it's just the unfortunate reality of modern life. Most of us are stuck working on a computer for most of the day, or even when we get off work, we have other responsibilities. So, um, but there is always ways to work it in. It's only 30 minutes, 5 days a week to reach that goal. And the easiest way to do it is to do something that you would otherwise already do or that you enjoy doing. So whether that's a sport you enjoy, playing with your kids, walking your dog, even playing golf, which is seems like it's not exercise necessarily, but it really is. I mean, you're walking around a huge course in a lot of cases for hours, so that's definitely a good one as well. But you just want to find something that you enjoy so it doesn't feel like extra work. Um, yeah, and as I said before, for the individuals who don't want to track calories, you really want to focus on this exercise and the previous slide, dietary modification, because it will help you lose weight even if you're not tracking your calories, and it reduces your risk for diabetes, which is the goal here. Okay, so now we're going to talk about how to manage diabetes through nutrition if you are diagnosed. So nutrition management of diabetes, the main thing here is that we want an individualized diet plan that is going to be sustainable and that you're going to be able to stick to long term. Similar to what we just talked about, you don't want to be forcing yourself to eat things that you don't enjoy. You do need to eat healthy and you do need to stick to what your plan is, but there is always room to compromise and come up with things that you do like. And ideally, you're doing this under dietitian supervision, especially when you have diabetes. It's very important. Having regular follow up every 3 months with a dietitian has been shown to increase dietary adherence, and it leads to an average drop of 1 to 2% in blood sugar, and it leads to better health outcomes. 1 to 2% may not sound like a lot, but as we showed with the diagnostic criteria, it's only around 5 to 6% when you're getting into the danger zone. So a 1 to 2% reduction is very significant. So goals of nutrition intervention to promote healthful eating patterns, to achieve body weight, glycemic, blood pressure, and lipid goals, delay and prevent the complications we talked about, and to provide individuals with tools for meal planning rather than focusing on individual nutrients, and to maintain a consistent blood glucose level. So consistency in intake in type 2 is the most important thing. You want to be maintaining a consistent blood level as much as possible and not causing super big spikes in insulin. So first, we're just going to talk about the individual macronutrients really quickly and how you should be thinking about them as you're planning your meals. So with carbohydrates, you want to spread out your intake. Carbohydrates is the most important for people with diabetes, of course, because that's what's affecting your blood sugar the most. Really spreading out your intake is going to help you to keep a consistent blood glucose level, as we already talked about. You want to focus on complex carbohydrates, and examples of that would be sweet potatoes, legumes like black beans, kidney beans, lentils, things like that. Even bananas as well would be complex carbohydrate. And make sure to get fiber. So that goes hand in hand with the complex carbohydrates. Pretty much all of those are going to have some fiber in them. And ideally, you're going to use a strategy such as carbohydrate counting when planning your meals, which we will talk about in a second. And you're going to want to limit your added sugar intake to 10% of your intake. And you don't need to cut out natural sugar. That is definitely a misconception. Things like apples and a lot of other fruits actually have soluble fiber, which is not, it's going to cause your blood sugar not to rise as high. So it is sugar, but it's not the same as having soda or something like that. So with fat, you're going to want to limit it to 20 to 35% of your calories for the best results, especially with regard to cardiovascular protection. If you're having too much fat, you are at higher risk for heart disease, which is you're already at higher risk if you have diabetes, so you want to be careful of that. You want to increase your mono and polyunsaturated fat intake. So that's things like nuts and vegetable oil, fish as well. You're going to want to reduce your saturated fat. I would say the saturated fat, that's been overstated somewhat. It's not the most harmful thing for you. Trans fat is a lot worse, but if you do have an extremely high intake of saturated fat, it is not good. And trans fat, as I just said, you want to cut it out completely if you can. It is extremely bad for you. It is linked to the highest rise in bad cholesterol, and it is also linked to cardiovascular disease and many others. In terms of protein, you just want to meet normal protein requirements for your size and weight. You want to focus on lean sources of protein. Going back to the fat, you don't want to be having extremely fatty burgers and stuff every night. So you want to stick to some healthy examples like salmon, nuts, beans, and chicken. Or even turkey as well. Turkey is probably an even better option. Okay, so as I mentioned before, if you do have diabetes, you want to be doing use a consistent strategy to plan your meals. And the easiest one that's the most commonly taught nowadays is carbohydrate counting. And it's the easiest one to teach as well. But it may not be appropriate for all cases, so you definitely want to make sure you check with your healthcare provider to see if it's right for you. If you are on your own and you have a milder case and you want to manage it yourself, you can do this all yourself. So we're going to go over how you can do this right now. So carbohydrate counting is based on the principle that your blood glucose level is going to rise similarly no matter what type of carbohydrate you choose. So it's basically splitting all your carbohydrates for the day into choices. So you know you have a set number of choices for the day and you can spread those out evenly. So each choice is a 15-gram serving of carbohydrate, and the patient chooses options based on preference and eats them evenly throughout the day. So the patient is taught to measure their own food portions or use a food list. So once you know how many choices you have throughout the day, you're going to use one of these food lists to pick out the foods and plan your meals. Or if you're measuring yourself, then you can just use your measurements and figure out exactly how many carbohydrates you're eating at each meal. So now we're going to go over an example of how to do carbohydrate counting yourself. The first thing you're going to want to do, as we discussed before, is figure out how many calories you're having every day. And you can do that using the calculator linked in this presentation, or you can use another one. As long as it's relatively accurate, then you should be okay. And once you know how many calories you're having every day, you are going to be aiming for 45 to 55% carbohydrate intake. So anywhere in there is okay. I'd like to go maybe a little lower than 50%, but for the sake of simplicity, we'll use 50%. And what you're going to do is you're going to take that number, that percent, and you're going to divide the total calories by the percent of carbohydrates you're going to be eating. And in this case, we used 50%, so it's going to be half of 2,000, and that is going to be 1,000 calories from carbohydrate per day. And once you have that, you need to know that each gram of carbohydrate you eat is 4 calories. So in order to figure out the number of grams of carbohydrate you're going to have per day, you divide the total calories by 4 calories per gram of carbohydrate to get 250 grams. And then that's your total grams of carbohydrate you're going to be eating every day. And then you're going to divide that into 15-gram choices, as we talked about on the previous slide. Each choice is 15 grams a serving. So once you have your total grams, then you divide that by 15, and you will get roughly 16 carbohydrate choices. So you have 16 choices of 15 grams each a day, and you can use those choices however you want, but ideally you're going to be spreading them somewhat evenly throughout the day. So as we can see in the picture on the left, this is basically the same example, and this person chose to have 4 portions of carbohydrate for breakfast, 4 for lunch, 2 as a snack, and then 5 for dinner, and 2 as the second evening snack. And they did go over by 1, but it's roughly, I think it was actually 16.6 choices we had, so closer to 17, so that's fine. So once you have the number of choices and you want to go about planning your meals for the day, you want to consider spreading them evenly, as we said. You can do it somewhat on the fly though, and it's really based on your preference. That's the whole point of this method. So now what we're going to do is we are going to do an example of how you would plan breakfast using this method. Okay, so here's our example. So we have 16 total choices, not 15. What do we want to eat for breakfast? So let's say we want to have a bowl of cereal with blueberries and half a bagel. So what we're going to do now is check our food list, our carbohydrate choice list right here. So this is our list. We said that we want to have half a bagel. So as you can see, each one of these is a choice, and it shows the serving size for one choice. So a quarter of a bagel is one choice. So if we want a half a bagel, that's going to be 2 choices. So there's our half bagel. Then we're going to scroll down, and we're going to find our cereal. Have a few choices. You could either have granola, which you would be able to have a quarter cup. You could have hot cereal, half cup, and all of those are going to give you one carbohydrate choice. So it's up to you. Let's just say we want hot cereal, so that includes oatmeal. So oatmeal, half cup, and that's another choice. So we have 2 choices between the bagel and the oatmeal. And then if we scroll down farther, we can find our blueberries somewhere over here. Right here, yeah. So we could have 3/4 cup, and that would give us another choice. So that would be 4 choices total. 2 for the bagel, for the half bagel, 1 for the blueberries, and 1 for the oatmeal. And of course, you can have other food as well. You could have butter on your bagel. You could have eggs. That doesn't count as a carbohydrate choice at all. This is just with regards to things that have sugar and starch mainly. So I can go back. So based on this breakfast, we will use 4 carbohydrate choices, and we'll have 12 left to spread throughout the day. So you may be thinking, that sounds great, but what if my food isn't on the list and I still want to eat it? Well, you can actually make your own food list, and all you have to do is have the nutrition information for whatever food you want to add. So I'm going to show you how to do that really quick right now. First thing you're going to do once you have the nutrition information in front of you is take a look and make sure that the information you're looking at is 1 serving, or see how many servings it is. If it's 2 servings, you're simply going to divide the answer that we get at the end by 2, or however many servings you were looking at on the food label. So the second thing you're going to want to do once you've figured out how many servings you're looking at is find the number of grams of carbohydrate. In this case, it's 26. Then you're going to want to subtract the fiber from the grams of carbohydrate. And the reason we do that is because fiber actually decreases the effect that carbohydrates have on your blood glucose level. So the more fiber, the less your blood glucose will rise when you're eating sugar or any carbohydrate. So now that we have found the number of grams of carbohydrate and subtracted the fiber, we're going to divide by 15 because that is how many grams are in one carbohydrate choice. In this case, we have 26 minus 0 grams of fiber. Divided by 15 is going to be about 2 choices. It's going to be a little bit less than 2 choices, but it's okay to roughly estimate. And now that you know that one serving is worth 2 choices, you can add that to your own food list, and you can build out a list of foods that you eat all the time, and you can plan very accurately and know exactly how many carbohydrates you're eating. Okay, so we're going to talk a little bit about another method of meal planning called the plate method, and this is can be used in combination with carbohydrate counting, um, but really it's if you don't want to count carbohydrates and you want to do it in a easier and it's like a quick and dirty way to plan meals and feel comfortable that you're still getting a balanced intake. It's easier and it may be great for those with prediabetes, especially because you don't necessarily need to carbohydrate count, but you do want to be making sure that your intake is um, sufficient and that you're getting the right amount of carbohydrates, the right amount of protein, making sure that you're just eating healthy. So the plate method, basically, all it is you are planning a meal and you want to have these proportions on your plate. It's similar to my plate, which is the government, the new food pyramid, basically. It shows how much of each type of food you should have on your plate in any given meal. This is similar, but it's specifically for diabetes. So what you want to aim for is half a plate of non-starchy vegetables. This can be leafy greens, broccoli, cauliflower, zucchini, cucumber, anything that's not starchy and doesn't have a lot of carbohydrates. And you also want a quarter plate of complex carbohydrates. This can be sweet potatoes, whole grains. It looks like they've got some quinoa or some type of grain that's a whole grain, presumably, on the plate in the picture. And then the last thing is a quarter plate of protein foods. And like we said before, you're going to want to stick to leaner stuff ideally. Um, Salmon is great, ground turkey, chicken, it looks like, is on this plate. Those are all fine. Okay, so now that we've talked a bit about meal planning, we're going to briefly talk about some emerging nutrition research and how it affects diabetes. So, one of the things I've been reading about personally lately with regard to diabetes is probiotics and prebiotics. I'm really interested in this area because I actually work for a kombucha company. For those of you who don't know, it is a fermented tea that's high in probiotics. Um, and there's actually been a fair bit of research on probiotics and their effect on overall gut health, but also specifically, they've done studies where they give diabetic people a supplement that has probiotics in it, and they measured how it improved blood glucose or didn't improve, and some other factors as well. So, um, probiotics are basically just microorganisms that are beneficial to gut health. And a recent review of randomized controlled trials using supplementation showed improvements in blood glucose control. So, actually taking these probiotics, um, the group that took them had better blood glucose levels at follow up compared to those who did not take them. Um, so you could implement this yourself if you want to try it. This is an area of ongoing research, I will say. It's not going to magically cure you or anything like that, but it's something that has been shown more and more to be beneficial to overall health, so I would recommend it. You can find probiotic supplements at pretty much any store nowadays. Do be careful with what you get, though. I would really recommend just getting them from foods. You can get the same effect pretty much. You're going to be getting less from food than a concentrated supplement, but it's a lot easier. So yogurt is high in probiotics, sauerkraut, kimchi, or kombucha, as I mentioned. There's also been some research on prebiotics, which are different than probiotics, and the two do get thrown around as being, almost as if they're the same, but they're really not. Prebiotics are just food ingredients that are non-digestible, specifically in humans, and promote the growth of good gut bacteria. So they are things like starch, like resistant starch that the bacteria in our gut actually eats, not us. They metabolize it. And fiber as well. So whole grains have prebiotics, sweet potatoes, and a lot of the foods we've already mentioned. And there's been some research as well on this, where similarly they took a prebiotic cocktail, or it's sort of a supplement, and it improved metabolic and inflammatory markers. And it may improve glycemia, so blood glucose control, as well. And as we mentioned, those are some foods containing prebiotics. Another hot topic right now in diabetes is high protein diets. There has been a bit of a craze with keto diets and high fat, high protein diets. I will say this is not quite the same. The diets in these studies still had caloric restriction associated with them. Keto diets do as well, but these diets were likely a little bit lower in fat than a lot of the diets that people may be promoting. But it has been shown in a few studies that high protein and low carbohydrate diets may be superior for weight loss, glycemic control, and cardiovascular disease risk in patients with type 2. Again, all these diets in the studies utilize calorie restriction and most moderately restricted fat. So just because it is a high protein diet doesn't mean you can just go eat a bunch of burgers and really fatty red meat. It's not that at all. It's still a more controlled diet. It just happens that the proportion of protein is higher and the carbohydrates are lower. So again, if you do want to implement this, you're going to want to focus on lean, healthy protein like fish and beans for best cardiovascular protection. Okay, so now I'm going to summarize all the nutrition points that we've talked about so far, coming to wrap up the presentation here. Let's take a look. So in summary, these are the most important points in preventing and treating diabetes when it comes to nutrition. So you're going to want to find a way to lose and maintain a healthy weight, whether that's through calorie restriction and calorie counting, and being very vigilant of that, or if it's just through overall lasting lifestyle changes where you, as we mentioned, make a bunch of big changes to your diet and start exercising frequently and don't count calories. You can also lose weight that way. You don't necessarily need to always count your calories, but you do need to find a way to get to a healthy weight and maintain it. And then, as I just said, try to make healthy changes to your diet overall. As far as fats, you want to go for healthy fats, nuts and seeds. Avoid trans fats, very bad. Limit your saturated fat to a degree. And you want to go for lean sources of protein, fish, beans, and lean meat. We want to have consistent carbohydrate intake. That means even intake throughout the day, making sure our blood glucose isn't fluctuating a lot, and we're not just eating all our carbohydrates at one time and then not having any for the rest of the day. You also want to limit your added sugar and focus on complex carbs. And as we talked about, if you have diabetes, you want to use a consistent method to meal plan. Even if you have prediabetes, I would recommend implementing the plate method. You don't need to carb count necessarily, but Plate method is a great way to just make sure that you're on the right track. Of course, you want to stay physically active, and the key to that, as we mentioned, is making it enjoyable. Find something that you enjoy. Have a workout partner if you want to go to the gym, or play with your kids. Just find an enjoyable activity that you can do regularly. And lastly, you can try incorporating some new healthy foods into your diet. Example, fermented foods, as we just talked about with the probiotics. And just really, you want to switch up your diet and make it interesting. Even if it is things that you think might not taste good, you might end up liking it. You never know until you try it. And if you are at risk for diabetes, make sure to get a checkup at least once a year. That means if you are overweight or obese, or if you have family history of diabetes, and really anyone over 30 should get a checkup once a year. Um, and that brings me to wrap up. You can come visit us at the Campus Health Center here. We're going to have diabetes testing, and you can talk to your own healthcare provider as well if you want to. Um, if you are interested in finding a dietitian, I would highly recommend it. They can really help get you on the right track, and we do have a very unique set of skills that you're not going to find with other healthcare providers. Right. Thank you so much, everybody, for listening. We hope you enjoyed it. As I said before, this presentation is available for download at health.wayne.edu. If you're on YouTube, you can head over to the link here and download it. There's also some other great resources on the website, so go check it out.